Howdy everyone, Dr. Paul here, and today we're tackling a problem that's as old as time itself, worms in sheep. Now these aren't your garden variety earthworms. We're talking about internal parasites that can wreak havoc on your flock if you're not careful. We're going to be talking about the troublemakers you need to watch out for, like the barber's pole worm, Haemonchus contortus, and the brown stomach worm, Teladorsagia circumcincta. These little critters can cause all sorts of problems, from anemia and weight loss to, in severe cases, even death. But don't you worry, we're not going to leave you hanging. I'm going to share some tried and true strategies to keep those worm populations down and your sheep healthy and thriving, so stick with me and let's get those sheep feeling their best. Let's start with a real troublemaker, the barber pole worm. This parasite is a major concern for sheep farmers around the world. This nasty parasite lives in the sheep's stomach and it's a bloodsucker, literally. It attaches itself to the lining of the stomach and feeds on the sheep's blood, causing significant health issues. It gets its name from the way the females look, like a little barber pole, red and white spiraled together. This distinctive appearance makes them easy to identify under a microscope. Now these worms are sneaky. They can multiply quickly in your pastures, especially in warm, moist weather. This is why it's crucial to monitor your flock regularly, particularly during the warmer months. And the worst part? You might not even realize your sheep are infected until it's serious. The symptoms can be subtle at first, making early detection challenging, so what should you be looking for? Well, anemia is a big one. Anemia occurs when the worms drain too much blood from the sheep, leading to a lack of red blood cells. The worms suck so much blood that the sheep become weak and lethargic. They may spend more time lying down and less time grazing, which can affect their overall health and productivity. Their gums and eyelids might look pale instead of that healthy pink. This is a clear sign that the sheep are not getting enough oxygen in their blood. You might also notice bottle jaw, which is swelling under the jaw caused by fluid buildup. This condition is a result of the low protein levels in the blood due to the worm infestation. Another telltale sign is weight loss. Infected sheep may struggle to maintain their weight despite having access to plenty of food. The sheep just aren't thriving. They may appear listless and uninterested in their surroundings, which is a stark contrast to their usual behavior. They might have diarrhea and their wool might look dull and lifeless. Healthy sheep typically have bright, clean wool, so any changes in its appearance can be a red flag. In severe cases, these worms can even be fatal. If left untreated, the infestation can lead to the death of the sheep, causing significant losses for the farmer. Now, how do you diagnose this nasty critter? Well, there's a handy little tool called the Haemonchus system. This system helps farmers assess the level of anemia in their sheep by examining the color of the lower eyelid. It involves checking the color of the sheep's lower eyelid. A healthy sheep will have a bright pink eyelid, while an anemic sheep will have a pale pink or white eyelid. If it's pale pink or white, that's a sign of anemia, which could mean barber pole worms. Regular checks using the Haemonchus system can help catch infestations early. Of course, the best way to confirm the diagnosis is to have your veterinarian do a fecal egg count. This test measures the number of worm eggs in the sheep's droppings. This tells you how many worm eggs are present in the sheep's droppings and helps determine the severity of the infestation. By knowing the extent of the problem, you can take appropriate measures to treat and manage the infection, ensuring the health and well-being of your flock. Next up, we've got tapeworms. These parasites are often overlooked, but they can be quite a nuisance for sheep farmers. Tapeworms are flat, segmented worms that can grow to be quite long, sometimes reaching several feet in length. They might not be as notorious as the barber pole worm, but they can still cause significant issues in a flock. These flat, segmented worms might not be as well known as the barber pole worm, but they can still cause their fair share of trouble. Tapeworms have a unique way of surviving and thriving inside their host. Unlike the barber pole worm, which feeds on blood, tapeworms absorb nutrients directly from the food the sheep consumes. Now, tapeworms are a bit different. They don't suck blood like the barber pole worm. Instead, they attach themselves to the lining of the sheep's intestines using their specialized mouth parts. This allows them to stay securely in place while they feed. Instead, they live in the sheep's intestines and steal the nutrients from the food the sheep eats. This can lead to a range of health issues for the sheep, including weight loss, poor growth, and general unthriftiness. The presence of tapeworms can be particularly problematic for young lambs who need all the nutrients they can get to grow strong and healthy. One of the most obvious signs of tapeworms is seeing segments in the sheep's droppings. These segments, known as proglottids, contain the eggs of the tapeworm and are shed regularly into the environment. These segments look like little grains of rice and can often be seen with the naked eye. If you notice these in your sheep's droppings, it's a clear indication that tapeworms are present. While tapeworms might not be as immediately life-threatening as some other parasites, they can still cause problems, especially in lambs. Young lambs are particularly vulnerable because their immune systems are not fully developed, making it harder for them to cope with the parasite load. Lambs infected with tapeworms might not grow as quickly as their healthy counterparts. This can lead to stunted growth and a failure to thrive, which can have long-term impacts on their overall health and productivity. They might have a pot-bellied appearance and just not seem to thrive. This bloated look is often a result of the tapeworms taking up space in the intestines and interfering with normal digestion. In severe cases, tapeworms can even cause intestinal blockages, which can be life-threatening. These blockages can prevent the normal passage of food and waste, leading to severe discomfort and potential complications for the sheep. Thankfully, diagnosing tapeworms is relatively straightforward. Regular fecal examinations can help identify the presence of tapeworm segments, allowing for timely treatment. Just keep a close eye on those droppings. Regular monitoring and prompt treatment can help keep your flock healthy and free from the unwanted guests in their gut. Chapter 3. Now let's move on to the lungs, where we find lungworms. These sneaky parasites can cause a whole host of respiratory problems in your sheep. Lungworms live in the airways of the lungs, and they can make it difficult for sheep to breathe. You might notice your sheep coughing a lot, especially after exercise. They might have a runny nose and their breathing might be rapid and shallow. In severe cases, lungworms can cause pneumonia, which can be fatal, especially in young lambs. Diagnosing lungworms can be a bit trickier than some other parasites. Your veterinarian might listen to the sheep's lungs for any abnormal sounds, like wheezing or crackling. They might also take a fecal sample and examine it for lungworm larvae. Chapter 4. Now let's talk about a parasite that often flies under the radar. The liver fluke. These flat leaf-shaped worms live in the liver of infected sheep, and they can cause some serious damage. Liver flukes are sneaky. They have a complex life cycle that involves snails as an intermediate host. This means they can be more common in wet, marshy areas where snails thrive. Sheep infected with liver flukes might not show any obvious symptoms in the early stages. As the infection progresses, you might notice weight loss, poor growth, and a general unthriftiness. In severe cases, liver flukes can cause anemia, swelling in the jaw and abdomen, and even death. Diagnosing liver flukes can be tricky. Your veterinarian might perform a fecal exam to look for fluke eggs. In some cases, a liver biopsy or even a post-mortem examination might be necessary to confirm the diagnosis. Chapter 5. Last but not least, let's talk about a parasite that can cause some truly heartbreaking symptoms, the meningeal worm. This parasite is particularly insidious because it targets the central nervous system of its host, leading to a cascade of debilitating effects that can be devastating for the affected animals. This nasty parasite infects the brain and spinal cord of sheep, leading to a range of neurological problems. The symptoms can be quite varied, making it difficult to diagnose early on. Now, the meningeal worm has a rather roundabout way of getting into sheep. It doesn't directly infect them, but instead uses an intermediary host to complete its life cycle. It actually starts its life in the lungs of white-tailed deer, where it lays its eggs. These eggs then travel up the respiratory tract of the deer. These eggs are coughed up by the deer and passed in their droppings. The larvae then hatch from the eggs in the environment, where they are picked up by snails or slugs. Sheep become infected when they accidentally ingest these infected droppings while grazing. The larvae are then released in the sheep's digestive system. The worms then migrate from the sheep's intestines to their brain and spinal cord, where they cause inflammation and damage. This journey through the body is what leads to the severe neurological symptoms. Symptoms of meningeal worm infection can vary depending on the severity of the infection and where the worms are located in the nervous system. Early signs might be subtle and easily overlooked. Some sheep might show mild signs like incoordination or weakness. These symptoms can progress over time, becoming more pronounced and debilitating. Others might develop more severe symptoms, like paralysis, seizures, or even blindness. These severe cases are often fatal, as the damage to the nervous system becomes too extensive to recover from. Sadly, there's no treatment for meningeal worm infection. Once the worms have reached the nervous system, the damage is usually irreversible. This makes early detection and prevention all the more critical. Prevention is key, and that means keeping your sheep away from areas where deer are known to graze. By managing grazing areas and monitoring the presence of deer, farmers can reduce the risk of their sheep contracting this devastating parasite. Regular health checks and being vigilant for early signs of infection can also help in managing the health of the flock. Well, folks, we've covered a lot of ground today, and I know it can seem overwhelming. But remember, the key to keeping your sheep healthy is to be proactive. That means implementing an integrated parasite management plan, or IPM for short. This involves using a combination of strategies to keep those worm populations in check. Think about it like this. You want to make your pastures less hospitable to worms. Rotate your pastures regularly, graze different species together, and keep the grass at a healthy height. And don't forget about strategic deworming. Work with your veterinarian to develop a deworming schedule that's right for your flock. Remember, folks, a healthy sheep is a happy sheep. So, let's all do our part to keep those worms at bay.